And welcome into To Your Health. You know, if you saw the show last week, you found out that we had Dr. Elizabeth Jackson, who's a cardiologist in Birmingham, talking about the heart. Last week we talked about how the heart ages. This week we'll be talking about some signs that you may be having some problems with your heart. So let's get into today's show. Well, Dr. Jackson, you know, last week we did a great job learning how the heart starts to age. And then, you know, with age, like anything else, if you have a car and it's getting older, it's going to have problems. So I guess the same thing can happen with our heart. And what we want to know is what are some of the things we need to look to say, hey, I better stop and pay attention to this?
Great questions. So with heart disease, we can think of a couple different things. There can be things like abnormal heart rhythms, but also things like heart attacks. And so let me talk about heart attacks first, because unfortunately, we do have many people who are at risk for having a heart attack or have had a heart attack and are at risk for future heart attacks. So hopefully many of us understand some of the warning symptoms of heart attacks: chest pain, chest pressure, particularly with exertion, but happening at rest is particularly concerning that the heart attack is happening right then and there. New changes in terms of breathing, just a lot harder to get out to your mailbox or get up the stairs. You know, if a heart attack is happening, it's not uncommon for people to have chest pain and the breathing problems, sometimes with some sweating during that acute episode, sometimes with some nausea. But I want to make sure that your viewers know that not all of those things happen for every single person. We know that women can have more atypical symptoms and men can have some atypical symptoms too. So one of the things you want to understand is, you know, what do you feel like now? And is there a big change? Certainly with chest pressure. Are you at risk for having a heart attack? So knowing your risk factors, which we talked about last week. And then if you're not sure, particularly if you're having that chest pain at rest with sweatiness or other things, you want to get yourself to see someone in the emergency room right away. You don't want to miss that early symptoms. We have great information on this. I know we're limited in these interviews. American Heart Association, wonderful information on this, as well as American College of Cardiology. So I would urge people to understand those symptoms, either for yourself or a loved one, someone in your family or down the street, that particularly if they have risk factors, so that you can help identify. The same thing goes for stroke. I know we're talking about heart, but I want to put in a plug for stroke because that's very important as well. Slurred speech, changes, weakness in an arm, limbs, things like that. So those are two things that you can learn a lot about. It doesn't take a medical degree to understand the warning signs for these two big events, heart attacks and strokes.
So basically, if you're doing some routine things like you're raking leaves in the yard and all of a sudden you feel maybe a little bit tired or you're starting to feel a little bit of a strain, that's one of the signs that maybe obviously the blood's not doing what it's supposed to do and it's ready for a heart attack.
Yes, exactly. So, you know, you've been, you know, raking on the weekends, you've been doing this, you know, level of physical activity, and then today, you know, you just can't get things done. Maybe a little pressure, maybe some nausea. It's just not you. That's the time to think, am I having a heart attack? Are these some of the warning signs? Particularly if you have risk factors like diabetes or smoking or hypertension, that's going to put you at a higher risk. So seeking medical attention right away, that means if you're really, you know, you're not feeling good, you're going to call an ambulance. You're not going to drive yourself to the hospital.
Let our viewers know, because you mentioned diabetes. How does diabetes affect the heart to where it can cause the heart attack?
Great question. So that's one of the major traditional risk factors. We've long known over decades and decades that people with diabetes are at higher risk for having heart attacks. It's because it affects blood vessels, including the ones that feed the heart, to create more plaque. It can make more of an inflammation around plaque, and we know that plaque or atherosclerosis can be more unstable and fracture and cause a blockage in your heart, like coronary artery, if there's more inflammation. So we really want people to have, their lipids controlled, their blood pressure controlled, as well as their blood sugar if they're diabetic. So seeing your doctor regularly and asking about all of your risk factors, even if you're not diabetic, but particularly if you're diabetic, will help go a long way to protect you from having that acute blockage in the heart.
And thank you, Dr. Jackson, and have you come back next week. And what we're going to talk about is when you do find out you've got a problem, what are the different ways of treating it? Does it need to be open heart surgery or just like you say, just something simple?
Perfect.
Okay.
Great segue into next week.
And thank you, Dr. Jackson. Very nice as usual. Some great information. Just remember, if you're having one of these problems, don't sit around. Get to an emergency room.